नमस्कार, सत श्री अकाल, आदाब, गुड मॉर्निंग, गुड आफ्टरनून एंड गुड इवनिंग जहां से भी आप हमें सुन रहे हैं. थैंक यू फॉर ज्वाइनिंग आवर लाइव सेशन. माय नेम इज कुंजन मवार. हमें आपके होस्ट और दोस्त फॉर टुडेज लाइव सेशन. ई ग्लोबल डॉक्टर्स digital health hospital connecting patients across the globe to doctors all over the world. In today's session, we will be exploring and providing more information about cancer treatment in conversation with Dr. Dodul. Good morning, doctor. How are you doing?
Good morning, everyone. And I'm great. Hope you all are doing fantastic.
Thank you, doctor. And would you like to provide a little introduction about yourself to our viewers and listeners?
Yeah, thanks for that. So I am Dr. Dodul Mondal. I'm a practicing cancer specialist from Delhi, India. I work at Max Super Specialty Hospital, New Delhi, which is situated in Delhi, India. And I really thank you for inviting me in this fantastic session.
Thank you. Pleasure is always ours. I know that I learned a lot when you are with us, and I'm sure our listeners and viewers will agree. So with that, this is our second part, Doctor. Welcome. So this is our second part. Before I go into the questions for cancer treatment today, if you can recap the first part that we did for cancer care, it would be really helpful.
Yeah, that's very nice of you. In the part one, we kind of discussed the overall cancer landscape in the entire world, and also I tried to give some views about India. And then we tried to discuss a little bit about the different aspects of diagnostics, cancer screening, different early symptoms of cancers, and overall treatment approaches for different kind of cancers. So kind of a generalized overview and perspective into oncology and cancer diagnosis, cancer treatment, cancer screening.
Perfect. With that, I am gonna start today's session, which is about cancer treatment. So my first question, what are some new cancer treatment that have emerged in recent years, and how do they work?
Very nice question. So as I briefed in the last session, like cancer treatment has different parts, or you can say that we divide into surgical treatment, systemic treatment, and radiation treatment. So these are three main pillars of cancer treatment. And we have been witnessing spectacular advancements in each and every field. Like nowadays, we talk about robotic surgery in cancer care. And then a little bit of specific things like in breast cancer, we talk about sentinel lymph node biopsy. We talk about avoiding full-fledged axillary dissection for lymph nodes. We talk about different types of newer approaches to breast reconstruction. And then in systemic treatment, we talk about categorizing the patient, whether they need chemotherapy or whether they can be they can omit chemotherapy safely and continue with some other medicines without giving significant side effects. Then we also talk about newer developments in radiation, like the particle beam therapy, like carbon ion therapy, like proton beam therapy. So we also talk about more focused and precise radiation, like stereotactic radiation, ablative radiation. So these are definitely some kind of new things, which I'd say is not exactly very new, but yes, is gradually being adopted in day-to-day clinical practice in a significantly large number of countries gradually.
Okay, perfect. That's actually good to know. Cancer is always a scary term. So if there are new treatments which are helpful, then of course, why not? So what are some targeted like therapies different from traditional cancer treatment, and how can they improve the outcome?
Yeah, again, a very interesting question. Like traditionally, when you talk about cancer care or systemic treatment, so by saying systemic treatment, we mean to say a treatment or a medicine which can reach the entire body. So when a medicine reaches the entire body, of course, other than killing the cancer cells, it shows its effects on the normal and healthy cells of the body as well. So the kind of toxicity we experience with such conventional approaches with chemotherapy, quite some time it becomes significant, and the patient develops a lot of problems in their daily life. And that can include like drop in blood count, nausea, vomiting, hair loss, change of skin color, loss of taste, and many others. So scientists have been working relentlessly on these things, and they have definitely been able to devise new treatments, which they have given a interesting name like targeted therapy. It means that the new medicines or the molecules are able enough to target the cancer cells more specifically than the normal and healthy cells. By saying that, we must remember that a targeted therapy does not mean that it would not have or it does not have any other side effects. So whenever I discuss with patients or family members, I explain this thing that that does not mean that when we are giving a targeted therapy or precision medicine or precision radiation, that there will not be any side effect. The side effect intensity or the spectrum of side effects will be different, which the patients will be able to tolerate in a much, much better way, right? So the targeted therapies, by saying it's targeted, we mean that it will target some specific molecule or say, for example, a specific receptor on the cancer cells, allowing the medicine to show its effects mainly in the cancer cells. So they will destroy the cancer cells. And by being very specific to the receptors or some molecules which are mostly present on the cancer cells, they will be able to spare the side effects from the normal cells. Like we use some monoclonal antibodies, right? So like in breast cancer, I'm giving this example of breast cancer because that is one of the commonest cancers worldwide, and also one of the cancers where targeted therapy or use of targeted therapies have been in clinical practice for a long time. Like we use a medicine known as trastuzumab that specifically targets a receptor like HER2, which is present in the cancer cells. And the concentration is many, many folds higher than in normal cells. So that molecule or the medicine can actually target the cancer cells where this HER2 receptor is present. So that reduces the side effects on normal cells. But of course, it does not mean that it will not have any side effects, right? But the side effects are lesser compared to normal chemotherapy. So that's how it is.
That's actually pretty amazing if you think about it, and how intelligent is the target therapy that they know which cell to target and which cell to leave aside. So
Right.
it's pretty, yeah, it's pretty fascinating. So we talked about therapies. Let me talk about, can cancer have a personalized medicine? Like, how does it allow doctors to tailor a treatment for individual cancer patients?
Yeah, it's a very, again, a very interesting question. I mean, the personalized medicine is not only about cancer, I would say that way, that a personalized medicine, which is also known as, you can tell it like precision medicine, personalized medicine. So it's basically it's a model. It's a model which differentiates different people, so one from another, and customize the need for that particular patient. So it's not a generalized approach we earlier used to have. Like when we decided about chemotherapy, the factors which we usually take into account are like what is the tumor size, what is the stage, what is the age of the patient, whether the patient is in a fit condition to tolerate chemotherapy or not. So like that. Now from that, we have gradually been moving to a customized, tailored approach, and that includes detailed analysis of the tumor itself, right? So I can give you one example. Like, again, I'm giving this example of breast cancer because that's one of the commonest cancer, and a lot of research is actually started with that. So in early breast cancer, there will be a specific population or a subset of patients where we'll be having a specific test known as risk of recurrence. So there is some commercial tests available to know what is the risk of recurrence in future if the patient is being treated with chemotherapy or without chemotherapy. So say, for example, the test is known as Oncotype DX, and it separates out the patients into 3 different categories: very low risk, intermediate risk, and high risk of recurrence. And there is a scoring criteria like 0 to 10, 10 to 25, and 26 or more to 100. Now, the patients having a score of 26 to 100, we know that they will be benefiting from chemotherapy because the risk of recurrence is much, much higher than the patients having a risk score of 25 or lesser. Now, in a patient who is having a score of 0 to 10, say, for example, they have a very low risk of recurrence. Probably they are, not probably, I'd say now there are a lot of evidence to support that they are the specific group of patients where adding chemotherapy does not give you much additional benefit over hormonal therapy alone. So hormonal therapy means the patient needs to pop a pill every day with a much, much lesser side effects profile. That means the cancer control will not be compromised, but the side effects of chemotherapy can be avoided in this particular group of patients. So you are doing a test to know exactly in which category the patient is falling, customizing their treatment. That, okay, this particular group of patients, they do not need chemotherapy, or the quantum of benefit by adding chemotherapy is very, very negligible. So you can safely omit that. So that is how precision medicine works actually. And it's like there will be some way or other ways to know in almost like every cancer. Now we are also talking about sequencing of genes of cancers. That is another way of customizing or tailored approach to cancer treatment. So you sequence the entire genome of the cancer and then come to know what exact mutations the cancer cells are harboring, and whether we do have any specific treatment against those specific mutations, and whether that specific treatment can give meaningful benefit or not. So that means we are now segregating patients not based on the size of tumor or age or their performance status. Rather, we are going more into detailed analysis of the tumor cells, finding out which treatment can be best suitable in that particular group with better outcome and reduced side effects. So that's the basic concept of personalized medicine, you can say. But saying that, I would not say that that is the end of the story. There are different other approaches, or there are different other things inside personalized medicine. One very interesting thing I would like to share here is theranostics. It's just a very interesting example I wanted to share. So theranostics is another way of personalizing cancer care. It includes 2 words, therapeutics and diagnostics. So you combine them and you get theranostics. So it's a way where one particular medicine is utilized to diagnose a specific problem, and the same molecule or medicine is used to treat the same cancer. The best example is thyroid cancer, where we use radioiodine to diagnose the presence of cancer cells in part of the bodies, and then the same radioiodine used in a higher dose to kill the remaining cancer cells. So now things are gradually moving in that way. So we can talk about like medicine, we can talk about like theranostics. So all these are part of precision medicine or personalized medicine, you can say.
That's actually very interesting to know, and good to know that it's like a one-on-one treatment based on what you just described, and not putting everybody in one box because one size fits all. So
yes.
That's wonderful to know. I am quickly going to talk about a new feature that eGlobal Doctors Digital Health Hospital is coming up with. New project called eGlobal Ayush. This project is for Indian folks working in USA, UK, Australia, and Europe. Do you worry about your parents back in India? eGlobal Ayush package will help provide medical service needs for NRI parents in India. For more information, make sure you do visit eglobaldoctors.com. Before I move to our next question, there is a question that came actually from our life. So let me ask you the question. So the question is, can a proper balanced diet control the cancer? Can intake of proper water also help?
So a balanced diet and taking proper amount of water is absolutely needed, no matter whether it prevents cancer or not. Uh, there are a lot of hue and cry about diet and cancers, but I must share that there are a lot of studies there are a lot of studies have been published with contradictory results on diet. So I remember sharing this thing in the first session also, that it's not actually the diet per se, but most of the time it's the chemical substances used to prepare that diet or food or to preserve them, which is the main culprit, right? Like I was talking about some dry meat preparations in some other program, which uses a lot of chemicals. Like we are aware about a lot of noodles where some specific ingredients are being used for making them more tasty. So those chemicals are actually the main culprit rather than the diet itself. Now, there are a lot of concerns about eating non-vegetarian food causing cancers. There are a lot of discussions like probably a vegetarian food is the solution to prevent cancer. I would say that these things are definitely good for making a healthy lifestyle, but cannot say that reducing non-vegetarian food in your diet is the absolute or the only key to prevent cancers. So the results are contradictory. The information, most of the time, you cannot be able to make a study where you will have millions of people where everything is same and only the diet is different. Then there are a lot of other factors coming in, and you will not be able to figure out whether it's actually the diet or other factors like pollution, like insecticides, pesticides being used so rampantly, preservatives being used so rampantly. So we never know.
So thank you for that insight. So hopefully whoever asked the question, you got a little bit more knowledge. Like doctor said, make sure to read what has been added to preserve the food so that it increases the shelf life or it enhances the taste. So pay attention to everything before buying stuff like that. If you need further clarity, we do take questions live. So please, you are welcome to put your questions in the comment boxes, and people at the back end will let us know the questions. So let's talk about what are some immunotherapy for cancer and how do they harness the immune system to fight cancer cells?
Wow. So again, a fantastic question. So immunotherapy or immuno-oncology, it has been I would say, like limelight since last almost 1 decade. It's not something very new, I would say. Like the concept of immunotherapy has been there since like 1970s. So it's a concept which is almost more than 5 decades old. But the clinical application of that knowledge is gradually becoming more and more common over the last 1 decade. So there is some, so people believe that immunotherapy actually boosts the immune system. So I would say it's not actually the boosting of immunotherapy, the immune system. What these drugs cause is stimulating our own immune system. So it's not boosting. I would say it's not boosting, it's actually stimulating the immune system so that our own existing immune mechanism can fight against the cancer cells. Now, technically and scientifically speaking, this depends on some receptors and molecules. Like when a foreign body enters our foreign body, like some virus or some bacteria enters our body, our immune system identifies them and kills those things. There are some receptors, we call them programmed cell death receptor or programmed cell death antigen. So these two things are present in two different places. One is the host, like the human being. the other in the foreign object, or you can say the cancer cells. Of course, the cancer cells, they grow inside our own body, but the body considers them as foreign object, right? Now, the programmed cell death receptor is, or the programmed cell death antigen, PD-1, they are present in our host T cell. The T cell is our main cells in the body which fight against cancer cells or foreign objects. And the ligand is present in the foreign, either the foreign object or the cancer cells. Now, when they attach to each other, there is a mechanism by attaching one to the other one that causes down regulation of the immune system, so that the body's immune system do not destroy the surrounding normal cells. So for example, virus entered our body and the immune system is fighting against the virus. So at the same time, the immune system can also destroy the surrounding normal cells. So this is a body's protective mechanism to downregulate the immune system. Now the immuno-oncology or the immunotherapy medicines are actually exploiting this pathway. So cancer cells are very smart. They know how the body works. So they are actually utilizing this pathway so that our body's immune system goes down and they are kind of saved from the immune attack on them. So they are doing this thing. Now you need something to block that. So if the PD-1 and PDL or the ligand, they do not bind to each other, this down regulation will be stopped. So exactly that is where the concept of immuno-oncology is stemming from. So the medicines are now trying to find out this system and blocking either the PD-1 or the PDL or the ligand. So if you can block the interaction, the down regulation will be stopped and the immune system will be stimulated to kill the cancer cells. Now the newer immunotherapies which you were asking, is a very interesting thing, that we have this immunotherapy medicines or the since the last couple of decades, and the most common cancer where this was utilized was a skin cancer known as melanoma. Like the ipilimumab, it's a drug which has been in use for melanoma for a long time now. So that is one of the first medicines, you can say, where which was utilized for treating cancers. There are several other drugs like nivolumab, like pembrolizumab, like atezolizumab. So there are different names like durvalumab, and all of them have their specific utilization or uses depending on which cancer, which stage, whether there is adequate percentage of these receptors present in the cancer, like I was saying, PD-1, PDL, all these things. So if these markers are present adequately, then we believe that yes, this immunotherapy or this particular medicine can show a greater response and benefit. Now, being very specific in their approach, these medicines have the potential to reduce side effects. But there is something which is known as autoimmune response. Like when this medicine are being utilized, there is a rare possibility that the body's immune mechanism or immune system can be stimulated so much that it can consider its own normal cells as outsider and start destroying them as well. So that is a very dangerous side effect, which rarely happens, but there is a possibility that it can happen. So as I was telling in the earlier, like this precision medicine or precision molecule or targeted therapies, they have the potential to reduce the side effects, but it's not like there will not be any risk of any side effects. So these immune-mediated side effects are known for immunotherapies, and that sometimes can be life-threatening as well. But that incidence or that risk of having that immune-mediated reactions are very, very less. So the quantum of benefit, what I was talking about, like the quantum of benefit is actually much, much more. And gradually we are having more and more evidence that these immunotherapies are showing great response in many cancers even in stage 4, most of the time, where the outcomes were very, very gloomy even a couple of years back, are now being improved. So I can give one example, like durvalumab is one of the newer medicines, which was tried in one of the clinical trials for stage 3 lung cancer. And that study showed that when durvalumab was used along with standard of care, the outcome was much, much better than standard of care alone. And the patients who received that particular medicine, their survival was also improved. So in terms of survival, like the 5-year survival was almost like the average survival, you can say the overall survival in that entire population, in the study population, was like 40, I remember it was like 48 months in the population who received that particular immunotherapy versus 29 months where the immunotherapy was not utilized. So it's one of the excellent studies where we saw that adding immunotherapy can increase the outcome significantly. Right.
Thank you for that insight. And I actually love what you said, that the quantum of benefit outweighs the risk. So that's actually amazing. There's always light at the end of the tunnel. So thanks for that positivity. And we have been talking about, how intelligent our human body is and how intelligent the new medication is, that it's targeting only to the cells which are bad or foreign to our body and protecting our own internal molecules. So I'm going to talk about artificial intelligence. So how is artificial intelligence being used in cancer research and treatment? And can it actually predict or identify the outcome of the new drugs that, the targeted drugs that you were talking about?
So again, a very nice question, and it's a thought-provoking thing. We nowadays are discussing a lot about this artificial intelligence or AI. It's an evolving science. It's an evolving science, I would say, and most of the things are under other research or clinical trials. So artificial intelligence is a very complex thing, and it has many aspects. It's not something which is a one-word solution or one-word discussion. So the name artificial intelligence itself signifies that it is something which is artificial in nature. So it's like you can say human brain, human analytical power, and just machine form of that human intelligence, you can say. Now, basically, these are all either softwares or machines which have sufficient data fed into them. So to have artificial intelligence into work, you need to have data. We call them like big data, where we have the information about, say, for example, thousands of patients, about their demography, their age, their performance status, their tumor nature. And the software are being developed to analyze them. So we have already known outcome in a large number of population. Those data are being fed into the software, being analyzed, and then a model is being created so that when in future you are putting a particular new patient's data into that model, you are coming to know about what is going to happen for particularly that patient. So it's kind of comparison between the existing information and new data being fed into the system to know how this patient is going to differ from the existing outcome when you are utilizing some specific treatment. Rather than the treatment part, actually, the AI is much more established in today's time in diagnostics or cancer screening. So probably you have heard about Google DeepMind. So that's a tool to screen breast cancer patients. So to reach that point, they had to feed like thousands of patients' data into the software to analyze the image character. And then it was found subsequently that that particular software can predict or analyze a mammogram, which is like a soft X-ray of the breast, and give more accurate prediction or diagnosis or information compared to a human being, compared to a conventionally trained radiologist. So trained radiologist was working specifically on that breast cancer screening. His report was compared to this AI-based report, and it was found that this AI-based report is much, much more accurate than human report. So that is how AI is becoming more and more important. Now, that's not the end. We are now having machines for treatment also. We are now having different other diagnostic approaches where this AI concept is being utilized. And very recently, one study was done in US, where they have utilized one concept of this AI, like natural language processing, NLP. So it's like when the doctor consults a patient, he or she writes notes. Now that handwritten notes or the system fed notes were fed into the software. They were analyzed, and they were analyzed to pick up some clues, which if present in that note can signify that this particular patient is going to have a higher risk of recurrence in future. So thousands of patients' information were fed into the system. Specific clues or words were picked up from the notes, and they were found to have association or prediction that this patient is going to have a higher risk of recurrence. Now, this software they created was then again utilized, and it was found that they're actually being able to predict the outcome. So that's very quite interesting thing.
It is actually very interesting. And I love the fact that you mentioned a historic data is actually used to predict. But that's not the end. Of course, you are the subject matter expert, but then we also have the historic data to compare what are the chances of risk factors. So I just want to quickly announce that if you are joining us, we are in conversation with Dr. Dodul about cancer treatment. We are live on Facebook, YouTube, Twitter, LinkedIn. So please hop on your favorite social media where we bring interesting topics to you. We do take questions live. If you have something which is quenching your brain, please don't wait. We have the subject matter expert with us. He will be answering your questions live. So there is another term that I have started seeing. Again, you probably know about it, but I don't research cancer that much on Google. But recently, I have started seeing what is CAR T cell therapy and how it can be used to treat certain types of cancer.
Yeah, it's a very new thing, and it's an upcoming thing. So CAR, basically it's a CAR, which means chimeric antigen receptors. So you can say this CAR T cells. So I was telling you that T cell is one component of our immune system, which takes a major role in killing cancer cells. Now, what scientists are now doing, they're engineering these T cells to give them an ability which will enable them identifying the cancer cells specifically. So to do that, they take the blood from either the patient himself or herself, or they can take the blood from a normal population. So when they take this blood from the patient, particularly then or the patient's own blood, it's known as autologous. And when they do it from the common pool or the patients, then it's like heterologous, you can say. So what they are doing after taking this blood, they are separating out the T cells and engineering them. So in basic mechanism, this autologous or this allogenic or heterologous, you can say, they're mostly same, only the source of blood is different. So after separating out the T cells, they're modifying it. Now, most of the time, so as of now, a lot of trials are going on. These engineered T cells have the specific capability of identifying cancer cells. And then once they find the cancer cells, they attach themselves with this, and gradually a cascade of reactions start inside the cancer cells, leading to death of the cancer cells. A lot of studies are going on, and as of now, most of the utilization of CAR T cells are related to blood cancers. So hopefully it will definitely come in a bigger way in many other cancers as well. It's quite interesting thing.
It is quite interesting. Like I said, this was something that, recently started surfacing. So you talked about patients and their families. So I'm going to ask you a question, that what is the role of patient advocacy in advancing the cancer treatment, and how patient and their families get involved in the research process?
Wow, very good question. So patient advocacy stems out from the word patient advocate. So now we need to know who is a patient advocate. So it's just like advocate for many other purposes. There will be people or person who will understand a particular patient's perspective and put it forward. Now put it forward where? Like in a court of law, we know that the advocate puts it forward in front of the judges or other persons. So here, the patient advocate will take it forward to healthcare facilities, different organizations involved in cancer research. So it's a nice way where the particular advocate will try to motivate or try to collaborate with the patient, and then try to kind of explain them about what is cancer screening, what is cancer diagnosis, what are the different ways of treatment, what are the kind of new researches going on, what are the kind of studies going on, whether that particular study is good to participate or not, what kind of interventions being utilized in that particular study, whether it can include serious things which can be harmful to the patient. And then with different other research organizations, collaborating with them, doing fundraising for treatment or research. So all these are basically kind of responsibility being played by the patient advocates. And these activities, we call them like patient advocacy program. So I would say this concept of patient advocacy is not very common in many countries. You can say like selective countries where this patient advocacy things are practically in use. And US is definitely one of them where this is very, very strong. So patients have their own support groups, their advocates, they interact with them, they understand, and then they can decide, other than, of course, fundraising, which is an important thing for treatment as well as conducting clinical research. So, of course, they are now being gradually integrated in many institutes for clinical trials, like the National Cancer Institute in the US. They have a national cancer coordination team kind of thing, a network, where including a patient advocate is now gradually being mandatory kind of thing. So it is definitely a nice and good way to make the cancer patients and their families aware about their problem, making them aware about different available treatments, the side effects, and to guide them about their participation or withdrawal from some clinical trials. So of course, they are having a big role to play in that.
So I do have a follow-up question. So it's good to have someone who is advocating and telling us, keeping us on track. But are the advocates also medical people, or they are specialists trained in certain areas?
So And there is no excluding factor, or there is nothing like a medical practitioner or doctor cannot be part of the patient advocacy program. But most of the time they are like from a different field, from a different specialty. So they would not have this kind of bias. So most of the time they will be from a different specialties. So the medical bias will not be there, and they will be having kind of a perspective like a common man or common human being.
Okay, that is where I was going. So thank you for clarifying that. So it's a third party, nothing related to the medicine or to the patient, and they are here to provide an honest opinion. Thank you for that. I do have a question that I see on our live. So the question is, what can I do to manage the potential side effect of cancer treatments?
That's a burning question, which almost every cancer patients or survivors have in their mind. To begin with this question, I would say that side effects of cancer treatment, they are definitely decided by kind of medicines or kind of treatments being offered. But at the same time, it also depends on who is the treating physician. So making a right treatment decision, deciding a right molecule, then if it is surgery or radiation, then doing the surgery or radiation in a proper way. So all these things ultimately decide about the grade of side effects or the amount of side effects one is going to have. Say, for example, a patient reaches Dr. X. Dr. X decides about a chemotherapy for a breast cancer patient. Again, I'm giving this example for an early breast cancer patient in a, so for example, a 60-year-old lady who has a very small tumor, so for a 1 centimeter tumor. So traditionally, we'll be treating that patient with a chemotherapy. And of course, we know that chemotherapies, these type of chemotherapies, they can have significant side effects. Now, the same patient went to have a second opinion to Dr. Y, and Dr. Y advised him an oncotype DX risk scoring criteria and found that the risk score is 8. And Dr. Y suggested that you do not need any chemotherapy, and just having a hormonal pill like tamoxifen or some anastrozole or letrozole is sufficient for you. So pop a pill every night or every day. And of course, the side effects will be much, much less. So it's a hormone receptor positive tumor. You are 60-year-old, you have a small tumor, there is no glands, no other risk factors. So of course, then the side effects are becoming different, right? So making a right treatment decision, implementing that properly, and then a good quality surgery, good quality radiation, giving a proper information during treatment that what can be the correct kind of side effects and what can be the different ways to mitigate them, using proper medicines or supportive care when the patients are having side effects. So all these are actually a combined thing which determines the final side effect or toxicity one is going to experience. So it's not a one-word solution. Now, once the patients are experiencing a particular side effects, of course, we need to take care of that specifically. And depending on what side effect, what is the grade of the side effects, we decide about some medications or occasionally withholding the treatment for some time to reduce that, or giving some medicine. Say, for example, a very common problem in anti-cancer therapy is a low blood count, where the blood counts fall down. So say, for example, the white blood cells are going down and it's a grade 3 or grade 4 side effect. So one might need to stop the treatment for a while, giving some injections to increase the blood counts. And once it is safe again, to resume the treatment. So these are different approaches depending on particular cancer, one particular patient, their ongoing treatment, or the less side effects one needs to decide. So I would suggest that please reach out to your treating physician, discuss what kind of side effects you are experiencing now, whether it is during the ongoing treatment or it's a side effect which you have developed months or years after treatment, where some kind of other type of supportive cares may be more helpful.
Okay, thank you for that clarity. So hopefully
welcome.
whoever asked the question actually got the answer. And like doctor mentioned, there are a lot of tests that they run. So if your immunity or if your score is lower of not getting cancer again and again, then chemo is not the option. They'll give you something which is related to hormonal. So please make sure you do visit the subject matter expert. We were talking about vaccines and treatment. So let me talk about what are some promising new cancer vaccines which are currently under development and how do they work?
So again, a very interesting question. I remember in the last session also, I have briefly mentioned about this vaccine. So vaccine traditionally means something which prevents us from developing a disease in future. Like there are a lot of vaccines against some infections. So, like once that vaccine is taken, the future risk of developing that infection is very, very less, like tetanus, like diphtheria. So most of these infections are nowadays having a lot of vaccines available. Uh, like measles. So all these are, there are some vaccines which once given gives a long-term immunity and the person may be safeguarded from having that infection. So uh, this concept was not quite common for cancer, but then the researchers found out that there are some cancers where the agent causing the cancer was some kind of infection. The commonest example was cervical cancer in women, which was a leading cancer in women once upon a time before the breast cancer took the first place. It was found that human papillomavirus, it's a virus which is mostly sexually transmitted or it's transmitted because of poor hygiene of the genital area. It was found that this human papillomavirus is responsible for almost 95% cases of cervical cancer. So, of course, it was thought provoking that if the 95% risk because of the infection can be eliminated by something, you are going to eliminate the overall cancer burden from cervical cancer by almost 95%. And the question was how? So the scientists now have an enormous knowledge about infection and vaccine. So they also utilize the same concept and knowledge to develop a vaccine for this particular cancer. And thankfully, a vaccine was developed. Now there are at least 2 multivalent vaccines against cervical cancer, which given at a proper time, at proper dose, can reduce the risk of having cervical cancer by almost 95%. And there are countries in the world where they have reported 0 cervical cancer cases after years of successful implementation of this vaccination program. So most of the time, this vaccine is given in preschool girls before being exposed to sexual interaction, and typically between 9 to 25 years of age. Now, there are differences in the doses being administered, what kind of vaccines are being chosen, depending on the availability of the vaccine in the particular country. So the physician or the preventive oncologist will guide them about the age, at what age they are coming, how many doses needs to be given, and at what interval. And it has been found that this cancer vaccine can be effective even up to 45 years of age. But of course, once someone is being sexually active, the quantum of benefit again, the quantum of benefit in terms of risk of the reduction of risk will be lesser once the person is into that age group of 25 to 45. Of course, it's not 0, but then the benefit will be much, much more in young girls who are not having any kind of sexual interaction. Right. Now, another cancer vaccine we can discuss about, like hepatitis B. So we all know that hepatitis B is again a sexually transmitted viral infection, and it's mostly associated with developing liver cirrhosis, one of the commonest cause of liver cirrhosis worldwide. Now, it's also one of the causes for liver cancer, primary hepatocellular carcinoma. So vaccination against hepatitis B virus can also prevent developing this liver cancer, where hepatitis V is very, very common. Now, for listeners or viewers from India, we know that in India, particularly, I can talk about hepatitis B virus infection is not the commonest cause for developing cirrhosis. So there are other factors also which needs to be taken care of. But in countries where this is very common, hepatitis B infection, cirrhosis leading to cancer, it's definitely recommended that you get vaccinated against hepatitis B as well. So preventing cervical cancer is an option with vaccination. Preventing liver cancer because of hepatitis B virus infection, they are of course in. Now there is a vaccine known as therapeutic, means a vaccine developed to treat the cancer. So I can give two examples. One is urinary bladder cancer, where we use a vaccine in very early stage cancers. And it's the same vaccine which usually we give to prevent tuberculosis. Now, the preparation or the formulation of this vaccine to treat bladder cancer is different from the one being given to prevent tuberculosis. So one should not have this idea in mind that I can just go to the chest physician or the tuberculosis expert to get me vaccinated and prevent this. So that should not be done. So urinary bladder cancer, once diagnosed, it should be managed by an oncologist or an urologist, and they will guide you about the role of this particular vaccine. One more cancer where this therapeutic vaccine is becoming an option is prostate cancer. Sipuleucel-T is again one of the newer therapeutic approaches. So it's a vaccine basically to treat prostate cancer. So we now knew that two cancers can be prevented, two cancers can be treated with cancer vaccine.
That's actually wonderful to know. Like I said, there is always a light at the end of the tunnel. So it's really good to know that it's curable and it's treatable. So don't get scared. So if you are joining us, we are actually talking to Dr. Dodul about cancer treatment. A new feature that was added is prescription shipping services. It's only for Georgia state, but at the rate that e-global doctors are going, you never know, next time we come live, we will have another different states for you. So e-global doctors have partners with Sugar Pharmacy to deliver medicines to the people of Metro Atlanta local community. For more information, you all know what you have to do. Visit eglobaldoctors.com. So let me check. I don't see any more live chat. So with that, I'm going to be asking Doctor for you, if you don't mind, and if you can summarize the session, cancer treatment session for us.
Wow, I would like to do that. So it was very interesting discussion, and the questions were really thought-provoking. And in this discussion today, we kind of discussed about what are the newer approaches to cancer treatment, what is immunotherapy, what is targeted therapy, how this patient advocacy program or patient advocates are going to benefit the patient in terms of outcome and cancer research. We have also discussed kind of on artificial intelligence, and we at the end we discussed about the cancer vaccines. So quite an interesting discussion in last almost 1 hour, and I really enjoyed it.
Likewise, the feelings are mutual. We always learn a lot when you are with us. So it's a wrap.
Thanks a lot for that.
Thank you. And it's a wrap. eGlobal Doctors is one complete healthcare platform solution for all your medical related issues and questions. And maze ki baat hai, all these services are available to you at your fingertips. Smartphone uthaiye, or without breaking your bank, take the consultations that you have been waiting for. So before I let you go, Dr. Dodul, any word of wisdom that you would want to share with our viewers?
Always, I'd like to do that, and I always like to share my thoughts about this entire cancer thing, cancer care, patients' concerns. So, and I always say that it's a suspicious mind which diagnoses cancer at an earlier stage. So be suspicious. Don't let go your symptoms without being evaluated. Take opinion from a qualified cancer specialist and treat yourself at the earliest possible time once you are diagnosed with your cancer. And with evolving sciences and evolving newer treatments, it's not all about darkness. There are a lot of hopes and hypes, and we really look forward to have even better outcome in coming days with all the newer treatments, newer molecules, newer radiation techniques, newer surgical approaches, and of course, support programs from different support groups.
Thank you for that wealth of information. Please don't be a doctor yourself. We have subject matter experts like Dr. Dodul. If anything out of ordinary that you see, then make sure that you go and visit the specialist. So, well, there you have it. With this is RJ Kunjan signing off. Sayonara. Stay tuned till we meet again. Keep smiling always. Namaskar.
Namaskar.